Hello, everyone. Now, for this week's discussion, we are going to be examining the use of pre workout supplements and whether they are an effective and safe strategy for improving exercise performance. Now, pre workout supplements have become extremely popular in both recreational and athletic populations. Currently, as a personal trainer, I see clients using pre workout pretty regularly, almost all the time, and I'm frequently asked whether the products are actually beneficial or if it's simply just an expensive marketing tool. Now, most pre-workout supplements are going to contain a combination of ingredients that are intended to increase energy, focus, endurance, and overall exercise performance. Some of the most common ingredients are going to include caffeine, beta-alanine, creatine, citrulline malate, taurine, and various other amino acids such as BCAAs or even essential amino acids. Now, caffeine is probably the most researched and effective ingredient found in pre-workout supplements. It acts as a stimulant by blocking adenosine receptors, which can reduce perceived fatigue and improve alertness, strength, power output, and endurance performance. Now, beta-alanine is another common ingredient that may help by buffering hydrogen ions during high-intensity exercise, potentially delaying some fatigue. Creatine is also well established as one of the most effective supplements for improving strength, power, and lean body mass. Although it works through chronic supplementation rather than providing an immediate pre-workout effect, ingredients such as citrulline malate are intended to increase nitric oxide production and blood flow, potentially improving muscular endurance and the so-called pump during exercise. So for my hypothetical case scenario, let's consider a 21-year-old collegiate basketball player. We'll name him Jake for sake of making it convenient. Jake participates in strength and conditioning sessions 4 days a week. Basketball practice will be 5 days a week, and he is currently preparing for his competitive season. His goals are to improve explosive power, increase training intensity, and maintain performance during demanding practices and games. Now, Jake has noticed several teammates using pre-workout supplements and is considered starting one himself. However, he has some concerns regarding safety, potential side effects, and whether these products will actually improve his performance. He is also worried about accidentally consuming a banned substance that could negatively affect his eligibility as a collegiate athlete. When examining the scientific evidence, the research suggests that some ingredients commonly found in pre-workout supplements can improve exercise performance, but the effectiveness largely depends on the specific ingredients and dosages included in the products. Now, research consistently demonstrates that caffeine is one of the most effective ergogenic aids available. According to the International Society of Sports Nutrition, caffeine supplementation can improve muscular endurance, strength, power output, sprint performance, and sport-specific performance. However, many commercial pre-workout supplements contain proprietary blends, meaning the exact amount of each ingredient is not fully disclosed. Now, this can make it difficult to determine whether the product contains clinically effective doses or not. There are also several safety concerns to consider. Excessive caffeine intake may lead to the side effects such as an increased heart rate, anxiety, elevated blood pressure, gastrointestinal distress, and sleep disturbances. As exercise professionals, we know that poor sleep can negatively affect recovery and performance. Additionally, because dietary supplements are not regulated as strictly as medications, there's always a risk of contamination or inaccurate labeling. Now, from an ethical standpoint, coaches and exercise professionals should avoid recommending supplements simply because they are popular or heavily marketed. Instead, recommendations should be based on scientific evidence and the individual athlete's needs. Collegiate athletes must also be careful to avoid products containing banned substances. So choosing supplements that are third-party tested by organizations such as NSF certified for sport is extremely important. Based on the current evidence, my recommendation to Jake would be first focus on fundamentals, including proper nutrition, hydration, sleep, and a well-designed training program. Now, if he chooses to use a pre-workout supplement, I would recommend selecting a third-party tested product that contains evidence-based ingredients, particularly caffeine and creatine, while avoiding products with excessive stimulants or undisclosed proprietary blends. Now, overall, the evidence suggests that pre-workout supplements can improve exercise performance when they contain well-researched ingredients. However, not all products are equally effective, and athlete safety should always be the primary concern. As exercise professionals, it is our responsibility to help athletes make informed, evidence-based decisions regarding supplementation. Thank you, and I look forward to hearing everyone's thoughts on pre-workout supplementation.